cases, mentally derailed persons litter the streets, posing threats to society. What is being done to restore this set of persons to their normal state of health? On this week's edition of The Tracker, I will be extracting the state of rehabilitation homes, correctional facilities in the state capital vis-a-vis global best practices. Nigeria has been grappling with a growing drug problem for several years, with cases surging on a daily basis. The age-long menace has been a contending battle for government at all levels, with no end in sight. Record from Nigeria Bureau of Statistics indicates that prevalence of drug use in Nigeria on a geopolitical zonal basis reveals that the Southwest tops the chart with about 4.382 million users, amounting to 22.4% of Nigeria's total figure of 4.3 million users. Statistics further reveals that no fewer than 294 drug abuse suspects were arrested in Ondo State. From June 2021 to date, about 30,000 kilograms of hard drugs were seized by the State Command of the National Drug Law Enforcement Agency, NDLEA, and about 65 persons have been sentenced to various jail terms. A very common effect of drug abuse is mental disorder, which has raised the cases of insanity in society alarmingly. The Ondo State government, through the Governor's Special Task Force, a Ministry of Women Affairs and Social Development, have continually evacuated persons with mental disorder from streets in night spots to sanitize the state. However, rehabilitation centers belonging to states across the country are left in deplorable condition as their structures and facilities are in decrepit conditions, Ondo State not excluded. This building here serves as both the correctional facility for juveniles as well as rehabilitation center in Ondo State. From the entrance, the resounding echoes of a Christian-like gathering indicates the presence of people in the compound. The first building directly opposite the entrance is moribund, with a blown-off roof adorned with weeds arising from neglect. A look at the left side of the compound where the fellowship is being held is another building. From all indications, it is where inmates are kept. Just like the first one, this building barely has a proper roof. The back view of the building has visibly tattered window nets. Another rehabilitation center at the Ondo State Command of the National Drug Law Enforcement Agency has, between the first and second quarter of 2022, counseled and reunited about 52 persons with their families. Ondo State Commander of National Drug Law Enforcement Agency, Mr. Kayode Raji, said between the first and second quarter of 2022, about 52 persons have been cancelled and reunited with their families. A figure Mr. Raji said could have increased if only the rehabilitation center of the command has the needed capacity to work. He said the facility can only accommodate 12 inmates at a time due to limited bed spaces, and at a time when there are influx of applicants, only a few are taken in while others are rejected.
We have a facility here, though improvised, where parents bring their children and their wards. So for now, the facility takes 12 at a time. But for now, we have discharged so many, so we have 5 with us currently undergoing rehabilitation. Of course, there are still so many applications that are waiting for approval. We discovered that the drug problem is a gargantuan one that we have to tackle frontally. Unfortunately, the facilities are not there. So, and we cannot fold our arms and allow things to go wrong. So what we did was to have a hostel within the command headquarters here, and to the best of our ability, we furnish it, and that is where we are using as their hostel. So I call it improvised because a standard rehabilitation center ought to have much more. For instance, there should be a specially built facility for such, where in their hostels, in their rooms, maybe 2 or 3 or 4 at most in a room, and there will be so many rooms, there will be facilities for, or offices for medical doctors, offices for nurses, for psychiatric doctors, for even pharmacists. So we don't have all that. So what we have to just complement what we are doing is that when there's need for medical intervention, if somebody's case has gone beyond counseling, that he actually needs medical intervention, what we did was that at a FMC or we have collaborators with their unit, their psychiatric units. So a psychiatric doctor comes in here to, again, a standard facility for rehabilitation ought to have vocations like tailoring, fashion designing, hairdressing, carpentry, and all that. So that when they live here, they will not be idle.
Findings from the National Drug Use Survey 2018, conducted by the United Nations Office on Drugs and Crime, revealed that 14.3 million Nigerians aged 15 to 64 years had used a psychoactive substance for non-medical purposes, meaning that 1 in 7 persons have used some substances other than alcohol and tobacco. More worrisome is the finding that among every 4 drug users in Nigeria, 1 is a woman. Despite having female applicants, Mr. Raji said the command is handicapped, and as such, female applicants are turned back in the course of the registration because the only facility available is for the male inmates.
We don't have facilities for female. That is not to say that females are not involved in all this. They are involved, but we don't have facilities for them here.
So if you have female patients,
so we normally tell them to go to any other place where they could get. Like in Lagos, for instance, you have a private rehabilitation center, but it's highly commercialized. They pay for it, and they pay heavily. Because it's privately owned, so you cannot begrudge them. But we don't have facilities for. We would have loved to, and that's exactly what I was saying when I was saying that we need public spirited individuals, NGOs, and government institutions to come to our aid.
The reality of rehabilitation centers in Nigeria, especially the government-owned ones, are in sharp contrast to global best practices. Rehabilitation centers utilize methods that does not only help victims of addiction effectively turn away from their addictions, but do it in such a way that the victims feel comfortable while in the process and are encouraged to rejoin society without the fear of being discriminated for their former addiction. Closely knitted to a rehabilitation center is a psychiatric hospital. The neuropsychiatric hospital in Ondo State has 16 bed spaces, each for the wards in the facility. The tracker was permitted to visit the wards, but without the cameras. There I met a 25-year-old who has spent a better part of his life on drugs. For 12 years, this young graduate from one of Nigeria's universities dedicated his life to marijuana, and according to him, he is not ready to part ways with it. This is a reality of 1 out of 10 Nigerian youths who have now seen a life in drugs while trying to shake off the shock of this 25-year-old stuck in drugs. I could not but notice the state of the words from the bed space to the unappealing environment. From January 2022 till August, 67 drug patients have been admitted, 112 general psychiatric patients were admitted, while some patients were transferred due to inadequate bed space. The General Outpatient Department takes in over 700 patients per month, a reflection of the facility's capacity. The head of nursing services at the State Psychiatric Hospital, Ige Emmanuel, said the absence of a proper rehabilitation center in the state is taking a toll on the discharge of their duties.
Generally, the psychiatric hospital was built with a capacity maybe to accommodate male patients like maximum 48, and the female patient, the capacity is not more than, let me say, 25. But with the current situation in the country, you agree with me that the hospital is already running above the capacity. And this is applicable to major healthcare institutions in the country. It is generally known that, going by WHO standard, you are supposed to have maybe a nurse is supposed to nurse like maybe 2 to 3 patients per shift. But with kind of the analysis I've given, you see a nurse here nursing almost 10 patients per shift, and that is to tell you the critical situation we find ourselves. So the personnel are doing their best, and in some situations you have a doctor seeing up to 30 patients in a clinic. But what can we do? We just have to make sure we do our best to make sure that we alleviate the suffering of our patients.
While highlighting the essence of a standard rehabilitation center, Ige said rehabilitation is needed to complete the treatment of a psychiatric patient.
There is difference between rehabilitation center and psychiatric hospital, though the two go together. Psychiatric hospital, there must be a rehabilitation center within, but in psychiatric hospital Ondo State, as I speak, we don't have rehabilitation center. We only have bed space for inpatients. A standard rehabilitation center, you know, the concept of rehabilitation is to restore to normal health, yes, to their previous status. So having a kind of rehabilitation center will require having what I can call the environmental factor now, which is one of the factors responsible for mental illness. So how will the environment look like? Is it an environment that is therapeutic, that will aid healing, recovery of patients? So we don't have that kind of facility here in Ondo State, where a patient that has been chronically, persistently ill, suffering from mental illness, or what we call vagrant, maybe they've been roaming the street for years and they are brought back. After psychotherapizing them, maybe they are placed on medication or whatever, you do psychotherapy, you do all those things, you need to push them in a place where they can feel that self-esteem, because bringing them back to their former status, restoring them to normalcy, to their previous status, require rehabilitation. And what you do basically is to make sure that you put them in a convenient place. That is therapist. For a patient that has been roaming the street for years, and the patient is treated and is fully okay, the patient is taken to a rehabilitation home. What will the patient do there? Some of them may need to go back to school. Some of them may need vocational training. If an occupational therapist is there, occupational therapist will take them through basic vocational training, maybe weaving, maybe soap learning or whatever. All these entrepreneurial skills they will be taught there, so that their integration back to the society will be seamless.
The Chief Medical Director of the Neuropsychiatric Hospital, Ondo State, Dr. Akinwumi Akinwoye, said the State Rehabilitation Center will only work effectively if properly managed.
On daily basis, people are resigning. As we speak now, we have almost less than half of the number we have to operate effectively on ground. Irrespective of commitment, irrespective of efforts to make sure things operate properly, you cannot go above certain provision. So the quality of service delivery in one way or the other will be affected. So this is a major challenge, and it's quite pressing that the government need to do something about fast. Citizens are already paying for this massive shortage of workforce in one way or the other. Then going back to details, like this facility need expansion. What we notice in recent time, when I say recent time, say about a year thereabout, is almost 100% occupancy of our beds. That was not the case 3-5 years ago, where male ward can just be around 80% occupancy, while the female ward around 50% occupancy. I'm talking about the number of beds and at any time how many of them are occupied. But in recent time, we have had to even send some patients back when we don't have space to accommodate them. So this institution was established over 30 years ago, about that, and the need for expansion is staring at us. We really need to expand the facility in terms of the number of patients it can accommodate. Then it also needs to be upgraded in terms of the quality of the facility, different sectors. We need to establish different subspecialties. We need standard.
In a telephone interview, the Commissioner for Women Affairs and Social Development, Mrs. Bumi Oshadaun, said government is putting in place strategic measures to give a facelift to the structure.
I can tell you now, this year 2022, which I am sure of, quite a number of developments is taking place. If you go around that place now, through the government, the solar system is being installed in the place to lighten up the place. Then some of the buildings that are not dilapidated, that are even being destroyed by the inmates themselves, is under reconstruction. In fact, sometimes, and quite a number of good humanitarian NGOs, they come in to give assistance. And every month, government pays a tidy sum of money to feed them in the home, take care of them, and buy clothes, change their clothing, give them good food, shelter them, and so on. So government is doing her very best. You know, because of their status, some of them are even very destructive. Even if you buy a cloth today, new cloth, and wear it on them, before evening, some can even look for something. Even they cannot get a knife or a plate. You just see, stress, torn. That's when they are part of the society. We can understand them and accommodate them with their challenges. The government is really taking care of them, giving them education. Some of them that can go to school, they are in schools. Then, and some of them too, sometimes we normally have training for them, and skill acquisition training. Government is making available. They have special doctors who is coming to treat them from the psychiatric hospital. Then those ones that I have told you, those ones that are young ones, that the ones we talk, some of them are even going to school. We have special schools for them that they attend, so that they will not be outcast or outfit in the society.
According to the World Health Organization, 1 in 4 Nigerians, about 50 million people, are suffering from mental illness. There's a report that Nigeria has Africa's highest caseload of depression and ranks 15th in the world in the frequency of suicide. Despite this disturbing revelation, there has been no mental health law in Nigeria save for the Regional Lunacy Law of 1958. The dictates of the law violates the fundamental human rights of persons with mental health and psychosocial disabilities, both in content and context.
By Section 45 of the Constitution, it talks about freedom from derogation or fundamental human rights violations. So irrespective of the sex, the status, the situation of anybody, suffering from incapacity, suffering from, even his way of birth. Somebody can say, look, he's a bastard, he's a lunatic, he's this or that, he's a mentally deranged person, he's somebody of unsound mind, okay? So the legality of the law, all these are checks and balances. To just say that by remote control, a person of unsound mind, if he's satisfied by a medical doctor that this person is not capable of mixing with the society, capable of not having the ability to live free with members of the public, so a magistrate court can order the detention of that person. So wherein it could be further medically examined at the psychiatric hospital or care for some time until he is fully rehabilitated and returned back to the society. But then, reformation of laws, constant review of our law is necessary, particularly, issue relating to our discussion now, that issue of people relating to people of unsound mind, lunatics, mentally deranged person, taken to psychiatric hospital from prompt and regular medical checkups, okay, so that their state of fitness, their state of mental alertness can be brought to fore, okay, they can be returned to the society, not just for a magistrate court on the order of a medical doctor certification that this person is on sound mind. From the archaic laws now of 1916 and 1958 should be further reviewed to accommodate that correctional centers, correctional homes, rehabilitation centers, rehabilitation homes, that where there will be clear and regular medical attentions given to them, to make most of our citizens who are medically deranged, littering the street about, be brought back to normalcy and peaceful Nigeria. And at the end of the day, our institutions will be further strengthened. The law should be there to strengthen our health centers. We are talking about child mother, mortality or mortality now. It was not like that before. So primary health care attention now being given, and we have primary health care officials who knew COVID-19 will come. Now we have isolation centers. So similar to that, the psychiatric hospital, how many now? Well, we have one in Ondo State now. The one Miko had, built at Laje there. You have this accident emergency thing and that. So medical centers, okay, could be on ground at the state levels to incorporate and take care of these people, so that more they can return back to normalcy and to the normal society status.
A social commentator, Jonathan Obatola, said there is need for government, spirited individuals, community leaders, religious leaders to work hand in glove to rescue the state from the menace of drug abuse.
There is a rise in cases of drug addiction, especially among the young persons. And this is a country whereby we have a lot of reasons for people to go into depression, a lot of reasons for people to get high on the streets, a lot of people, the level of poverty, insecurity, unemployment, and all those things are some flimsy excuses that some young persons give to be on drug. And sincerely, there's no rehabilitation centers that I'm aware of in this society that is effective. And the essence of rehabilitation centers in town is to ensure that people are taken care of, they are being counseled, they are placed on medications and attended to, so that to curb the side effect of drugs in their life. So it is very important for even civil society organizations that are into rehabilitation to make their activities more pronounced. The rehabilitation centers in Ondo, I'm not aware that the state government run any, but if there is, I'm aware of that of the National Drug Law Enforcement Agencies, but I'm also aware that the capacity is too low compared to the cases that we have on the streets. The government is doing a lot to take care of the girl child, especially through the office of the Arabini, the Ondo State government also is doing a lot when it comes to issue of insecurity, especially by the creation of Amotekun. But the government also needs to focus more on the welfare of people, especially young persons that live mostly on drug. And you can see cases of rape, cases of social vices that we have in the land can be traceable to drug addicts. So if we have rehabilitation centers in place, it will help to rehabilitate these young people early, and that is the best time to get them rehabilitated.
Psychologist Dr. Saliu Oyelami opined that proper enlightenment should be done by relevant agencies.
There are so many regulations and there are policies now on substances in our environment, but many of these laws are not being implemented. Many of these laws are not being implemented, and then when people are caught, they don't get the appropriate sanctions.
Rehabilitation also comes to play.
The issue of rehabilitation is now at the level of treatment. It means when prevention fails, people use substances and then they break down, they begin to have problems, they need to be rehabilitated. So there's nothing you're going to do. If you tell the young people, your children, not to use substances, and they use those substances for whatever reason, they break down, they develop complications, you have to rehabilitate them. So rehabilitation is very important. But when you look at our healthcare system today, you see that so many things are not in order.
WHO claimed that there are less than 150 psychiatrists in Nigeria, a country of over 200 million people, and that about 10% of mentally ill Nigerians have access to the care they need. The House of Assembly is a key to revitalizing dead laws and legislates on new ones in the interest of society. As the Ondo State House of Assembly consider this critical area for legislative business, or will the situation continue in perpetuity? The tracker will unravel the mind of legislators on the subject matter in subsequent editions. That's the size of the program for this week. Join me again next week.